And Dr. James Smith is a physician and also lecturer in humanitarian studies at UCL London. He joins us live now. Update us, Dr. James, on the situation, the humanitarian situation, what you're hearing, and also the medical situation in Gaza.
While direct attacks on Palestinians in Gaza by the Israeli military have diminished in frequency, the immediate humanitarian needs, and here we're talking about the most basic needs: access to clean water, access to nutritious food, access to basic medical care. All of these things are in extremely short course can be directly linked to all of the crossings that traverse the armistice line, and of course the Rafah border crossing between Egypt and Gaza. All of these access points are controlled by Israel, with catastrophic consequences for the entirety of the population in Gaza, which is still in need of all of these basic human needs.
And what about patients who are in need of urgent evacuation? Because the WHO has said there are about 15,000 patients that are in need of urgent medical evacuations.
That's right. More than 15,000 Palestinians in Gaza need medical evacuation. Approximately 4,000 of them are children. These are patients that require treatment that is no longer available in Gaza, and in some cases never was. There were a significant number of Palestinians that required medical evacuations outside of Gaza prior to October of 2023 as a consequence of the protracted occupation and blockade. Many of those patients, if they are not permitted immediate medical evacuation, they risk death. More than 700 patients are known to have died while waiting for medical evacuation over the course of recent months. That number of patients requiring medical evacuation will only increase if Israel does not permit, as it is legally obliged to, medical assistance into Gaza, and the sort of medical support, including access for healthcare workers, that is required to reinvigorate the Palestinian healthcare system in Gaza.
And Dr. James, at the beginning of our programme, we focused a lot on the search for Palestinian bodies by Palestinians themselves, sometimes with their bare hands. What are the health hazards there that you're worried about?
Well, this is incredibly risky to people's immediate physical health. We know that buildings have collapsed, killing and injuring Palestinians that are returning to their homes, along with rescue workers whose work is extremely risky. There is a huge amount of unexploded ordnance, unexploded bombs that have been dropped by the Israeli military. And of course, the other risks that are posed to people that are trying to retrieve the bodies of missing relatives and loved ones are extensive. The risk posed by dust, asbestos, that will cause long-term respiratory problems for Palestinians. Israel, of course, has also denied access for the heavy machinery that is required to conduct safe retrievals. And this is a major problem now for Palestinians who are taking it upon themselves to try and find the bodies of their relatives and friends.
Absolutely. Dr. James Smith from UCL, thank you very much indeed.